This press conference about a new and exciting initiative with the Darlington County School District and MUSC, the South Carolina Telehealth Alliance, the South Carolina Department of Mental Health, and the Duke Endowment. And this particular initiative is the new Darlington County School District Telehealth Initiative. First of all, glad to have everybody here. And I would like to recognize some folks that are in the room with us. I always have to recognize our principal of this beautiful campus that we have here, Mayo High School, Ms. Arlene Wallace. Thank you very much for letting us use the facilities. Would also like to recognize our board members that are with us, Mr. Richard Brewer, Ms. Wanda Haslett, and our board chair, Mr. Warren Jeffords. We also have with us one of our pilot school's principals with us, Ms. Melinda Brown. Melinda, can you wave your hand so everybody sees you? Great. Again, we're very excited about this opportunity to partner with the folks that are in the room with us. Schools for so long have been very focused on the academic well-being of our children, and that's what we do every day, but I think all of us realize as time has gone by that we have to also be concerned about the well-being of our students' physical health, as well as their mental health, the emotional, social piece to education that has really become so prevalent over the past decade. And this is a step in that direction to make sure that we're taking care of our kids in every way possible. So not only is it our responsibility to make sure that they're getting the best education possible, but that we're taking care of all their needs. This pilot is about helping students and their families have access to health care and to mental health care, physical and mental health care. It's an opportunity for us to help our families in ways that weren't possible 5 years ago. With the technology that's now available with this initiative, it's groundbreaking, but most importantly, it keeps our kids and families in our school buildings, which that's home base for them. And I think anything that we can offer for our kids and families in that manner is a level of comfort. And that's what we're after, is to be able to help them where they are. The particular pilot is involved with Lamar Elementary School, North Hartsville Elementary School, Pate Elementary School, and Southside Early Childhood Center for the physical part. For the mental health part, it's also Lamar, North Hartsville, Pate, as well as our Darlington County Institute, Intervention School, I apologize, Darlington County Intervention School. So that's the only difference with those two. Again, there is no cost to this program that is being offered. It is being funded by MUSC and the South Carolina Telehealth Alliance, the South Carolina Department of Mental Health, as well as the Duke Endowment. And there is no cost for the services to our parents and our families as well. But with that said, the people that are sitting to my left know a whole lot more about the initiative. And so it's very important that I let them talk. We'd like to recognize Senator Malloy, who just came in the room. Thank you so for your support. How's that for being on the spot?
I would like to go on the spot.
Yes, sir. But we appreciate Senator Malloy's support again from the funding standpoint and at the state level standpoint. Senator Malloy has been involved with this initiative, aware of it, and again, being in Darlington County, focused on that and how it affects our kids as well. I would now like to introduce Dr. Catherine Cristaldi, who is with MUSC, and will talk a little bit about the Physical Telehealth Initiative. Dr. Cristaldi, please.
Thank you so much, Dr. Newman, and thank you everyone for having us here today. walking in the door, and particularly today when we've all been hunkered down in chilly and now the sun's starting to break through, I think, what a great day in South Carolina. And it really is a great day for me when I get to sit with a whole community that's come together with this idea that we can make things better and we can come together for our children. And this project in particular really embodies that idea. The idea that we can, as a community, bring both physical and mental health together in the place where children and families know is really their community space and their home, and that's their school. So I really am excited about this project. I will say years ago when we started the school-based telehealth initiative in South Carolina, a lot of us had this dream for what would happen. We would go around and kind of speak to communities and healthcare providers and schools about this thought that we can bring health and wellness to children at school and really make our communities a healthier place, keep our children in school and learning, keep our parents at work. And sometimes people scratch their heads, but one great group of people did not scratch their heads, and that is the South Carolina State Legislature. And so I would, in particular, thank them for their support and the ability to bring this to our communities, as Dr. Newman said, at no cost. So particularly Representative Smith and Alexander and Senator Malloy who can be here today to celebrate this community. I'll say what was the most significant to me about Darlington County in particular was like I said, sometimes we go around and people would scratch their heads and they'd look at us and say, "You're going to see kids on the TV?" And I'd say, no, we can really do a full exam and we'll show you that today. Here in Darlington County, no one said that. Everyone said, that's what we should do for our children. So many of the providers who are sitting here today, Dr. Morphus, the leadership at Carolina Pines, and the group that's been serving the community at Care South, all came together and said, no, we absolutely will do this for our children. And then the group that really came through was the Department of Mental Health, who said, we can do this in an even bigger way here in Darlington County. So I will say it is truly inspirational to me that in this community, so many people have come together, sat around the table, and thought about how we can make this work for the community and for the children here in Darlington. So that's what I'm really excited to get to celebrate today and to get to watch this grow in this really exciting community. So thank you all so much.
Again, Dr. Cristaldi, thank you. When I first started talking to Dr. Cristaldi about the initiative, I believe it was back in June, which was my first or second week on the job. And so thankfully, we both were fairly new to what was going on in the concept, but very quickly over the past few months, Dr. Cristaldi and her staff have really come together, as well as with the district staff, to get this pilot in place and to get to where we are today. Again, I did want to acknowledge that we have folks from all three of our providers for the physical telehealth initiative, and of course that's Carolina Pines, and many folks with us from Carolina Pines today. Dr. Morphus with Morphus Pediatrics, and some of her folks, and then also with Care South. So we appreciate your support of the initiative, but can't wait to hear about some of the results for our kids, most importantly. The next part of the telehealth initiative, of course, is the telepsychiatry initiative. And this one was a little bit more involved in how to explain that. Louise Johnson is here with us from mental health, and she and I spoke on the phone a few times, and I think the first time I talked to Louise, the question was, Louise, how is this going to work? How are we going to do this? And because when you start talking about mental health practices and therapies and how counselors are involved with children, it's a very different scenario than the physical part. And so, again, thankfully, Ms. Louise Johnson guided me through that and guided our district and got us to the point today. And she's going to do just as good of a job explaining to you all as she did to me on how this system will work for our kids. But again, very thankful for Louise being here with us today. She is Director of Division of Children, Adolescents, and their Families from the South Carolina Department of Mental Health. And Louise Johnson, would you please come up and talk with us for a few minutes?
Good morning.
Good morning.
In May of 2018, the South Carolina Department of Mental Health was awarded a grant by the Duke Foundation to implement the first of its kind an integrated care proposal designed for children and adolescents of Darlington County. Our local PD Mental Health Center, having had a very long and rewarding relationship with the Darlington School District, provided us the perfect opportunity to propose an integrated system of care on behalf of the children here. Studies indicate that integration of mental and physical health will strengthen the ability to intervene earlier, and we need to intervene earlier, and more effectively, increasing the potential that the care that is provided will substantially aid longevity as well as quality of life. We plan to demonstrate to the rest of the state that we can successfully align behavioral and primary care services and thereby produce better outcomes. The project now is known as DC Cares, or Darlington County Cares. DC Cares will provide an extensive training for all those who are in contact with children and those who care about the health and wellness of the children here in Darlington County. We plan to promote a culture of wellness and aim to remove all barriers to care that could interfere with academic success. Let me say that again. We plan to remove all barriers to care that could possibly interfere with academic success, such as long waits for behavioral assessments or evaluations, parents struggling to follow up with appointments due to work schedules and competing demands, and the lack of transportation. Also, we know our teachers need support, and the infusion of more school mental health professionals could improve some of the behavioral health related discipline referrals and concerns that often lead to suspensions and expulsions. Many have long recognized the need for an integrated approach to care. A system of care where families, schools, mental health, and primary care providers actually work together to address the needs of the whole person. We must acknowledge that health conditions do not neatly fall into one category or the other. They do not neatly fall into physical health or mental health. That a doctor visit because a child is not eating or sleeping well could be a child in need of immediate mental health interventions. Or a child referred to mental health could be exhibiting depressed mood or behavior related to a chronic health condition. A coordinated approach which facilitates mental and physical health consultation among providers involved will only enhance care and improve overall outcomes. The data states that most suicide occurs within 2 weeks of a primary health visit. Suicide among our youth is increasing, and we can do better. There are often better outcomes when care is highly coordinated and well managed. I just want to thank the Duke Foundation again. Is someone here from the Center representative? Okay, stay down there. But I want to thank the support of the Duke Foundation and our partnership with MUSC, which I affectionately refer to as a marriage, which recognizes that too many people need better access to care. And their willingness to venture, like they said in the sci-fi world, where no man has gone before, and to the Darlington County School District for caring and embracing and owning this initiative. We will ensure that all schools have access to a therapist who will be able to telepresent to our mental health nurse practitioner, a doctor, as well as have access to our full array of mental health services. Through this grant, though, we will be able to screen about 500 children over 3 years for hearing loss through a contract with Beginnings. We will be able to do training for the entire district on trauma-informed care. We just completed an initiative with that with Richland 1. Now Richland 1 saying the whole district is trauma-informed. Darlington County District will be trauma-informed. We will also provide suicide prevention protocol and training for the entire district. We will also provide good evidence-based practice, mental health first aid. Oftentimes teachers and others don't know what to look for or what they're actually seeing. We will partner with Project Breathe Easy for Family Connections, who has the ability, when we have children with chronic asthma attacks, to go into the home to see what triggers are there. Children in Darlington County, as well as everywhere in the state, are in need of timely, on-demand evaluation and treatment of illnesses and behavioral health conditions without having missed long periods of time away from school and valuable seat time. My favorite person who's no longer here, Maya Angelou, always said, when we know better, we do better. Together here in Darlington County, we will do better. Thank you.
Thank you, Louise. And as I said earlier, she would do a much better job of explaining that, how the processes will be married together, as we talked about. So now we would like to have a chance to do a demonstration as well as show a video of how the program will work. And so at this point in time, Dr. Cristaldi, I think I'll have you come back up to the podium and talk a little bit about the video we're about to see.
Sure.
And we'll get that started, and then I think you're going to lead us through the demonstration.
I think so. That sounds good.
All right, great, thank you.
Well, I think this video actually speaks for itself. I've found that all the school and all, which is very important, and all the education I've gotten never quite prepares me to tell the story quite like the children who experience it. So I'm going to let one of those children tell the story.
It's very, very cool that we have like a doctor on the TV, like online. I feel like I'm video chatting with some funny things. School-based telehealth is a service provided through MUSC that serves children in rural and underserved areas. In my area in Hemingway, a lot of parents work out of town. They work in Florence, they work on the beach, because Myrtle Beach is nearby and it's a large tourist area. So a lot of times when children are at school and they become ill, there's not any recourse. By the time the parent gets from wherever they are, say it's Myrtle Beach, they ride public transportation there, so they don't have transportation to come and get their child, then the child can be seen by a medical professional at school where they are. Whenever I get hurt or sick, the teachers send me to the nurse and Miss T will check at it and see if I need a Band-Aid or call a parent. And if we need the telehealth machine, she'll set it up. The student will come in and for their visit, and I will sit them in front of the computer screen. Our medical professional, Kelly Garber, sees my kids, and we will connect through video, and video is a secure connection, and once we connect, Kelly can see us and we can see her. And there are different things. We have a stethoscope, and what I hear as I do the exam, Kelly hears also in real time. What I see during the exam, Kelly sees also in real time. And that way she's able to see and diagnose then and there. And also write the prescription, electronically send the prescription or call the prescription to their pharmacy, and all the parent has to do is pick the prescription up. It is just like an office visit, except for it's virtual.
Yes, ma'am. I described the telehealth consultation by, I think it's cool, and I don't have to wait for about 25 minutes like they do in the doctor's office. And it is better for my mom, so she doesn't have to come all the way to my school and take time off her job.
Being in the rural areas, the closest pediatrician is probably 30 miles away. I mean, we have a medical office, but the closest pediatrician for the children is at least 30 miles away. And also, with a lot of parents having to work, I mean, we have to go to work. Sometimes it's hard to take off days when you have other things, like you might have more than one child. It's hard to take off with illnesses or something. And if they're already at school, and the nurse can see them for a problem they have, it could be easier, very beneficial. What's the next color stop? What color name?
The telehealth consultation helps me in my daily life because they basically just heal my life, really. They basically heal me a lot and it makes me feel better.
You met Tristan here, who lives in Williamsburg County, but we'll be excited to hear from the citizens of Darlington County as well and hear about their experiences. So we're going to do a quick demonstration of the technology. This is the cart that we typically put in our schools because it doesn't take up a whole lot of space and it's fairly easy to use. So while you all were watching Tristan, I was able to just hit a button and turn this cart on. Typically, a child would present to the school nurse's office, and we've got several school nurses here today. They are very adept at assessing children and what their needs will be, and if they need to seek a higher level of care. School nurses, I think many people don't know that school nurses see 75 plus patients a day. Many healthcare providers, I think, would run screaming the other direction if you told them that they needed to do that. So we want to make this as quick and easy for them as possible, and yet still get the response that they need. So again, here in Darlington, we are quite blessed to have a community of providers who will be able to take a call from a school nurse fairly quickly. They can then connect using this card. So once they send a message out saying, I'd like a provider, that message actually goes straight to the provider in a number of ways. They're able to sit down at their computer, their laptop, frankly, even your phone, and accept that connection and speak with the school nurse about the patient. So there are lots of special people in the audience today. I may have one who can demonstrate for me. Eva, can you come here with Mom? So ready? So stand right here with a very big curl. Okay. So if Eva got sick and went to her school nurse, and maybe let's say that you wanted me to look at your tongue. Do you think the doctor needs to look at your tongue? Yeah? So she'd be able to make the connection to me or one of the other providers. And after also contacting the parent could come in person or call in on the phone. We'd get a history. Of course, this is secure audio-visual connection. so much like FaceTime or Skype. And then be able to do a full exam. So Eva, I think we decided that the doctor needs to look at your tongue, huh? You come here and show me your tongue? All right. You've done a great job. I'm so proud of you. You say, ah. Look at mama. Look at mama. Say, ah. Luckily, we brushed our teeth this morning. All right. And obviously, we could also look in Eva's eyes. Can I see your eyes? Great job. All right. Thank you. Great job. This camera, I'm going to go ahead and turn this camera off, otherwise Eva will look at herself in every angle she probably can. This camera can also be outfitted, this is the exam camera. It can show you rashes, small abrasions or injuries, obviously nose, mouth, eyes. It can also be outfitted with an otoscope attachment, like you see here, to show a very clear picture of the tympanic membrane or the eardrum. And then the device is also outfitted with a stethoscope, and a little bit of up here. But looks very much like a traditional stethoscope with a diaphragm and a bell that can be used to listen to the heart. So should we listen to your heart? And it's placed on the chest just like any other stethoscope. And the provider can hear very clear heart sounds. And again, lung sounds as well. So we're able to assess children with a little cough, like Eva has this morning, or asthma, as well as ear infections, strep throat, many of the acute illnesses of childhood that would send a child to the school nurse. All right, before we wander too far, I'm going to conclude our demonstration. Of course, if anyone had any questions, I'm happy to take those.
So I think it's also important to point out how this will help with our mental health folks in our buildings too, is that we have mental health counselors provided by PD Mental Health in our buildings. And what this allows to happen is once a student has been assessed and seen by a psychiatrist and mental health offices, from then on, they're able to use telehealth to do their appointments. So where in the past, if they had an assessment, every time the parent would have to take them back and forth, taking them out of school, typically during school hours, to go to those appointments. From the telepsychiatry initiative, our students, once they've had that initial assessment, will be able to stay in the building and work with the mental health counselors. So again, very unique ways that the technology is involved, as Dr. Cristaldi and Eva has shown us as well. And so with that, are there any questions from the group here as far as what you've seen so far?
Could you talk a little bit more about billing, funding, and how these services will be paid for?
So the question has to do with the actual services for the students themselves, correct? And as I said at the beginning of the program, there is no charge for the actual units and the services to the school district. So all of the technology is provided. That looks a lot more involved than my laptop, by the way. So I know that there's a lot of money involved with the technology piece that's being provided to each of our schools, as well as the actual services themselves to make sure everything's up and running and connected. And so as far as the actual billing, the students and families, the families will be asked to sign a document allowing us to bill Medicare or their insurance. And so we're able to use it just like a doctor's office. If our families walked into a doctor's office, how would they pay for those services between those two, between Medicaid and their actual personal insurance provider? And also, with that said too, I realize we have Kelly Parker here with us, who is our lead nurse. And so Kelly will be very prevalent in this initiative rollout because she is the contact person for our nurses, our school nurses, as well as the MUSC and Dr. Cristaldi and her group too. So, but hopefully that answers the question regarding families. Other questions? Okay. In just a moment, we're actually going to do a ribbon cutting, and so we would like for our senator, our providers that are taking part in this, our school board, and of course our panel, and Eva, to be with us on the ribbon cutting if we could. But with that said also, I'd like to know, Senator Moore, is there anything that you would like to say about the program?
Quickly.
Please.
Good morning.
Good morning.
Congratulations to, and thank you to all departments. This is very necessary. Many of us work during our lives and we want to invest in our 401ks and our retirement plans. We oftentimes wonder if we should start early because we want to make sure that we get our reward later. So healthcare is even more important. And I think that the earlier we start with children, making sure that we get healthcare is absolutely essential. A good healthcare for children is just like a good public education. It's sacrosanct. It's something that we got to have so they can end up taking care of themselves for the people that they will become. So thank you for looking out for our children today. Thank you for the work that you all have done. Thank you for being partners with Darlington County. And I hope these pilot programs are appreciated by all. Thank you, Dr.
So again, the Darlington County School District Telehealth Initiative, which focuses on the physical well-being as well as the mental well-being of our students. Again, no longer can school districts and schools be responsible just for the academic well-being of our students. We have to look at the whole child, and I'm thankful in Darlington County that we're doing that. I'm thankful for the folks that are helping us put this together from MUSC, as well as mental health, and for our providers. And we look forward to giving more information about the pilot in the very near future, and hopefully be able to roll this out to all of our schools in the school district. That is the plan. So again, thank you for being here. If our folks that I identified just a minute ago would help us be part of the ribbon cutting, we would greatly appreciate that as well. Have a great day.
Everybody ready?